Pleasant evening to everyone. I am Michael C. Manyo, and together with me, my groupmates are Raiza Macabenta, Ms. Ella Malid, Rautik Masukat. And today we are going to report about pharmacy information system. So first, let's define what is pharmacy information system. It is a system that has many different functions in order to maintain the supply and organization of drugs. It can be a separate system for pharmacy usage only, or it can be coordinated with an inpatient hospital computer physician order entry of information. So what is PMIS? The PMIS integrates pharmaceutical data collection and the processing and presentation of information that helps the staff of all levels of country's health system makes evidence-based decisions to manage the pharmaceutical services. So we have a pharmacy management information systems are also known as the pharmacy management software, the pharmacy system software, and the pharmaceutical management software. What is the importance of pharmacy information system? The importance of it is it has a good PMIS, and it provides the necessary information to make sound decision in the pharmaceutical sector. Effective pharmaceutical management requires policymakers, programs managers, and healthcare providers to monitor information related to patient adherence, drug resistance, availability of medicine, and laboratory supplies, patient safety, product registration, product quality, financing and program management, and so many. So what is the functions of PMIS? In clinical screening, the pharmacy information system can assist in patient care by monitoring of drug interactions, drug allergies, and other possible medications related to complications. So in an inventory management, the pharmacies are required to a continuous inventory culture in order to ensure that the drugs do not go out of stock. It is made even more difficult when there are multiple dispensing points. When done manually, it is very difficult to maintain an accurate inventory. The pharmacy information system is one of the most essential pillars of the hospital information system, and the pharmacy information system supports the distribution and management of drugs, and it proves the efficiency and the effectiveness of the services. So the pharmacy information system includes information relevant to a prescribed individual for safety medication, and it also monitor his or her healthcare over time and monitor the medication that are taken out of supply, and it calculates the inventory turnover rows and use this information to make the purchasing and inventory control decision to ensure that drugs do not go out of stock, and to ensure the patients receive sufficient coverage for all the care they require, and also to help the consumers and physician to understand the cost and usage of the drugs. And we have the stores, and to collect the data, the patient should be observed and monitored for advanced effects, and if there is an integral information system to reduce the interruption and workload pressure. So there is a type of pharmacy information system that will be discussed by Raiza Macabenta.
Types of pharmacy information system. Number one is prescription unit. Systems include computerized physician order entry and prescribing, which allow a doctor to electronically submit prescription and avoid mistakes from misread scripts. There are the second is database and inventory management. Pharmacies can easily access patient data through pharmacy information system software, as all information is stored in one place and accessed through one interface or computer. This information includes a patient's biographical records, current and past prescriptions, medical conditions, drug allergies, and insurance information. There are two main goals to keep in mind when managing an inventory for a pharmacy. The first is to ensure medications are available when patients need them. The products that are regularly kept in stock are based on the needs of the pharmacy and its customer. The second goal of inventory management is to keep medication costs at a minimum. The pharmacy technician should make an effort to use preferred delivery systems to try to keep acquisition costs as low as reasonably possible. Drug dispensing. Dispensing refers to the process of preparing medicines and distributing them to users with provisions of an appropriate information, counseling, and follow-up. While dispenser is any person who is licensed or authorized by the professional body to dispense medicines or medical supplies. There are functions of PMIS. So number one is an effective PMIS is able to synthesize the large volume of data generated by pharmaceutical management operations. It then processes the data into information for use in. Second is every stakeholder in the system should be able to access and monitor their own unit. Third, another important function of PMIS is to improve accountability. Much of the recording and reporting in a PMIS is intended to create an audit trail for products as they enter or leave a pharmaceutical supply system. The importance of HIS is to be reported by Ella Malid. So the importance of HIS, first the user interface. It is beneficial to all departments and allow the pharmacies to organize and select the orders to place in patient profile. Second, the security. It is also important with so many departments having some type of access to the connected computer system. Only certain departments need access to certain of the system. Next is the data retention. Plan is also helpful in a PIS so that the records are kept for a year or longer to help the pharmacies and physicians to understand the cost and usage of the drugs. Pharmacies can use patients' records to keep track of clinical screenings, what medications they're on, and what recommendations they may need regarding the healthcare. The dispensing refers to the process of preparing and giving medicine. It is the ability to report the usage of drugs, flow of dispensing and administrations of drugs, and the budget is helpful in ascertaining what is working and what needs to be altered. In the case future, manufacturing and compounding. Good to know. Drug manufacturing is the process of industrial scale synthesis of pharmaceutical drugs as part of the pharmaceutical industry. The second is the invention management. It is a pharmacies have intervention management modules as member of patient care team in HIS hospitals. So in the pharmacy system, support this by providing easily accessible automated logbook, which is the record quantity of drugs, expiration date of drugs, lot number on drugs, ingredients. Next. So in medical administration, the pharmacy system provides medication administration document form that the nursing department takes charge to support. While in the connectivity to other systems, pharmacy systems have been designed to receive laboratory results, enabling pharmacies to review them and use rules and guides or software which initiate certain action on a computer when specified conditions are met. Next, in pricing, charging, and billing. Admission, discharge, transfer system. It includes the charging of disposed drugs to patients from stored records and the mostly billing interface from pharmacy to hospital billing system. Next, so how does PIS assist in pharmaceutical operation? First is the clinical screening. It is the drugs are monitored and identified before dispensing to patients. And the drug interactions, drugs, allergies, and other possible medication-related complications are assessed. Next is the prescription management. It is to manage prescription from inpatients and outpatients. It is possible to track all prescriptions passed through the system from who prescribed the drug, when it was prescribed, and when it was dispensed. So, Rodic,
So these are the pharmacy information system, and to reiterate all of those, in a short word, the functions in order to maintain the supply and organization of drugs. The pharmacy information is used to reduce the medication errors, increase the patient's safety, and report drug usage and track costs. It is a way of saving life of one's patient by stepping all of those information and by acquiring this report. So I hope you learned with this short discussion from us. Thank you and goodbye.